Bismillahirrahmanirrahim. I am Semroze, the student of Mphil Microbiology from Gujarat University of Science and Technology. The topic of my presentation is COVID-19 vaccine acceptance and its associated factors among pregnant women attending antenatal care clinic in southwest Ethiopia. This report was published in International Journal of General Medicine on June 8, 2021. The contents of my presentation are abstract, introduction, material and methods, results and conclusion, acknowledgement, references. Abstract. The COVID-19 is a safe and effective approach against COVID-19 mortality rate. An institution-based cross-sectional study was conducted from January 1 up to 30, 2021. A systemic 396 random sampling technique was used to collect data. A structured and face-to-face interview was conducted for data collection. This data was then exported to SPSS, which is a statistical analysis software. The COVID-19 vaccine acceptance was found to be 70.9%. Introduction. COVID-19 is a global burden because globally it has imposed enormous rate of the mortality. Evidence shows that 2.5 million deaths are reported globally. More than 2.5 million deaths are reported globally. The risk of dying were higher among older adults people and the patients who had chronic medical related diseases such as lung cancer, asthma, diabetes, heart diseases, and immune compromised patients. Pregnant women are more resistant to COVID-19 and they have severe outcomes, that is, preterm births, undergoing cesarean section, intensive care unit admission, mechanical ventilation, and death. The COVID-19 pandemic effect can be lessened by the use of face masks. If we keep the physical distance, that is the 6 feet, if we avoid the outdoor activities, we should stay home. We should frequently wash our hand and the use of sanitizer. There is a very limited data generated regarding the vaccine acceptance among the pregnant women. However, American College of Obstetrics and Gynecology recommends that pregnant women should get vaccinated. The vaccine acceptance ratio varies globally. In India, Philippines, and Latin America, this ratio is higher than 80%. Russia, United States, and Australia, the ratio goes above 45%. In South Africa, this ratio is 81.6%, and in Nigeria, the ratio is found to be 65.2%. Overall, there is no clear evidence regarding COVID-19 vaccine acceptance in Ethiopia, particularly in the study area. Hence, the objectives of this study were to find the prevalence of COVID-19 vaccine acceptance, to know the reasons for refusal among pregnant women, what were the possible reasons, and to help administration to design a strategy. Methodology. A total of 396 samples were collected from different public hospitals in southwest Ethiopia, and the duration was January 1st up to 30th, 2021. The source population included all the pregnant women. The eligibility criteria included all the pregnant mothers following up the antenatal care clinic among different hospitals in southwest Ethiopia. And all the disabled pregnant women were excluded. Sample size, a total of 396 samples were collected from the different mentioned public hospitals in southwest Ethiopia. The data collectors and data collection procedures included 9 BSc midwives, 2 MSc holder nurse for supervising. The data was collected confidentially. There was a secretly collection of data. Questionnaires were provided. They were distributed among the population to collect data. And the data collectors too followed strict standard operating procedures. The data collected was then exported to SPSS for analysis and processing. Ethical approval and consent to participate, permission was granted. Ethical clearance was obtained. Participants were informed about the objective and purpose of the study. An official letter was written to all the selected hospitals. Results. A total of 396 women were involved, marking a mean response rate of 100%. The mean age for the study participant was 25.38 years. The majority of respondents, 185, that is 46.7%, were aged from 25 to 33 years old. Out of the total respondents, 365, that is 92.2%, were married. Regarding ethnicity, 66.2% respondents were from Gurage. 196 pregnant women completed their primary education and 53.5% were unemployed by occupation. Maternal obstetric healthcare services and characteristics. In this study, 217 pregnant women were multigravida, that is, a woman who has been pregnant for at least second time. 177, that is 44.7%, were pregnant women were multiparous, having more than one children. 319, that is 80.6% of the mothers had completed the antenatal care visit. Of these, 131 women had 2 times A and C care follow-up. Concerning the medical illness, 359 did not have any evidence of medical illness. Maternal knowledge, attitude, and practice of COVID-19 vaccine acceptance and its preventive measures. 87% of the pregnant women showed the good knowledge towards the COVID-19 vaccine acceptance. 12.9% had the poor knowledge. 66.7% showed the good attitude toward vaccine acceptance. 33% shows the poor attitude. The 61.4% had the good practice, and the 38.6% had the poor practice. Overall, the vaccine acceptance among the study participants was 70.7%. Refusals for the reasons for refusal of accepting COVID-19, 3.8% of the pregnant women thought the vaccine might turn into the COVID-19. 0.8% thought it might affect my fetus. 5.1% thought if I used other methods of COVID-19 prevention, that would be very effective rather than using the COVID-19 vaccine. The 6.1% thought it is ineffective and the 14% had the fear of side effect. The maternal source information regarding COVID-19 vaccine acceptance were different. Some of the pregnant women heard about the COVID-19 vaccine from media, that is television and radio, and the number included 34.5, 34.1%. 30.8% pregnant women heard it from healthcare professionals. 19.90 pregnant women heard about the COVID-19 vaccine from health extension workers. 9.6 heard it from friends, and 5.6% heard it from family and relatives. Factors associated with COVID-19 vaccine acceptance. The multivariate analysis showed that the maternal age from 34 to 41% and the primary education, good status of the good practice of pregnant women towards COVID-19 and its preventive measures were significantly associated with the COVID-19 vaccine acceptance. Those pregnant women who had completed their primary education were 3.5 times more likely to accept the COVID-19 vaccine compared to pregnant women who had no formal education. Those with the good attitude or good knowledge were approximately 6 times more likely to accept the COVID-19. The odds of acceptability of COVID-19 vaccine among pregnant mothers who had good practice showed 9 times more than pregnant women with the poor practices. Discussion. The newly emerged COVID-19 infectious diseases has adverse impacts on pregnant mother and their unborn fetuses following a 2009 pandemic, influenza pandemic and Ebola virus. The finding of the study present that the acceptance of COVID-19 vaccine among pregnant women was 70.9%, which is a higher than studies conducted in Saudi Arabia, which is 64.7%, United States 67%. Middle Eastern population showed the COVID-19 vaccine acceptance 36.8%, and Poland 31.3%. However, it was lower than the study conducted in Addis Ababa, which is 80.9%. In China, this vaccine acceptance was 91%. In Indonesia, 93.3%. Southeast Asia showed the 93.3%, and South Africa 81.6%. This study compares the COVID-19 vaccine acceptance with previous infectious diseases as the 2009 influenza H1N1 virus and the Ebola virus. Vaccine acceptance in pregnant women for COVID-19 was higher, which is 70%, and this ratio is higher than the vaccine acceptance for influenza virus. However, it is lower than the vaccine acceptance for Ebola virus. The possible justification might be the Ebola vaccine acceptance was studied among the healthcare workers who might have good awareness and attitude towards the COVID-19 vaccinations. Primary educated women were 3.5 times more likely to accept the COVID-19 vaccine because the educated primary mother had the ability to read news and follow social media related to COVID-19 virus impact on the general population. This finding was consistent with a study conducted in South Africa. 61.4% had the good practice towards the COVID-19 vaccine acceptance. 51% has the higher than the Gondar. However, it was lower in South Africa. This positive attitude is supported by a reason action theory, which states that an individual's intention to receive a specific behavior is a function of their current knowledge status towards that behavior. 13.6% had fear of side effects, 6.1% said it is ineffective, and the possible justification could be the rush of most of the countries to develop vaccine and to get more financial benefits that might result in ineffective production of the vaccine. The limitation of the study was the lack of the qualitative data to explore socio-cultural barriers of pregnant women's refusal. There was a restriction to information sources. The other limitation was the nature of study design, cross-sectional, does not show the relationship between the cause and effect. Conclusion: COVID-19 vaccine acceptance was found to be 70.9%. And regarding this, many factors were associated. That is, the good knowledge, the good practice towards COVID-19 vaccine acceptance, and the good attitude. This study recommends that healthcare workers should provide health education to pregnant mothers during antenatal care visits to increase their knowledge about the diseases and disseminate leaflets regarding COVID-19 preventive measures. The studies also suggest that the policymakers, healthcare workers, and health extension workers should work in collaboration to promote COVID-19 vaccine regarding its safety and effectiveness, and in turn to increase the acceptance of vaccine and to control the pandemic in the study area are highly recommended. Thank you for listening to me.